Hey everybody, welcome back to my channel. This is, as you can see, a video about giving report. Nurses giving report. I come from a background of working in a hospital setting for the last 10 years. That's kind of going to be the focus of this video, is how do nurses in the hospital setting give report. So I want you first to go to the link below in the description, and I have a link to one of my report sheets. It is a great comprehensive report sheet, everything you need, nothing that you don't. And if you follow this rubric while you are verbally giving report to a nurse, she will have pretty much no questions at the end, unless she thinks of something crazy, which, you know, we've all given report to, you know, that one lady, Debbie, who has 1,000 questions. Every floor has one. Let's start with the beginning of your shift. You are getting report. Always be available to get report. Don't hang out in the break room, finishing your breakfast, waiting to the last second. You know what it's like at the end of the day. Be available for report. Listen to everything and don't ask questions until the very end. It's best to kind of get that handoff done as quickly and as effectively as possible. So let's start with the report sheet that I have below in the link, and I'm gonna go through it as if I am giving report. All right, I'm gonna hold my computer because I don't have it printed out. Start with room number. All right, this is room 4029. Patient's name, Bob Jones, 45-year-old male, came in on the 3rd with symptoms of rectal bleeding and was diagnosed with a massive GI bleed. Admitted with GI bleed, admitted by Dr. blah, 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 and then the consulting doctors. Now, consulting doctors are a great time to talk about anything else that they came in with. Like, of course, if it's like a GI bleed, they probably have a GI doctor on the case. But what if all of a sudden they found something else crazy? So this is a good time to say they consulted so-and-so for this. And then the nurse is like, oh, so on top of having a GI bleed, this patient also has this. They consulted Dr. so-and-so for this diagnosis, because very rarely does someone come in for one thing and get treated for one thing, fixed, and then get discharged. Next, you're going to start with the past medical history. This is a great time to talk about maybe some like crazy medications they're on, like if they're on Coumadin or if they're on certain cancer drugs, you know, some really sensitive stuff that you can't mix with other things. Past medical history of blankety blankety blank, high blood pressure, high cholesterol, depression, diabetes, the usuals. And then code status, full code, DNR. Next, allergies, allergic to blankety blank. Now you're going to start with your assessment of the patient. So a verbal head-to-toe assessment really quickly so that the nurse gets an idea of what this patient looks like before you're entering the room. You start with neuro, alert and oriented times 1, 2, 3, 4. Language that they speak. When I worked in South Florida, we would get English, Spanish, Creole, so many things. Next is cardiovascular. You can talk about if they're hooked up to a monitor, what their telirhythm is. Next is pulmonology. Talk about if they're breathing room air or any supplemental oxygen or apparatuses, and then their lung sounds. Next, GI and GU. Are they continent? Very important. Any extra devices, colostomy bags, Foley, that kind of thing. And then their activity. Are they able to get up? Are they able to walk with assistance? Do they use a commode, ambulatory, and if there's therapy ordered? It could be STOT, PT. And then their skin. Is it warm, dry, and intact? No? Then talk about the wounds that they have, and then any surgical wounds that have been created on this admission. Very important to assess those every single shift, multiple times a shift. And then their access, IV access, PICC line, central line. Where is it? When was the dressing changed? And if they have any continuous infusions running. Very important. And then their diet. Are they on a regular diet, cardiac diet, full liquids? Are they NPO for a procedure happening today? And then are they AccuChecks? So important, especially for day shift. After AccuChecks, I have labs. labs that are not within normal limits and that are pertinent to the diagnosis. Don't tell the next nurse every single lab that they had done. Labs that are not within normal limits, maybe labs that are ordered in the next shift, and then labs that are pertinent to the diagnosis. Next, tests and exams. This includes x-rays, CTs, MRIs, nuclear med tests, all that sort of stuff. And then procedures, surgeries, caths, endoscopies, or any invasive radiology procedures. Next, the plan of care. So now we told you everything right and wrong with the patient. What are we doing about it? What is ordered that we are using to treat the patient and to get them to a healthier state? What are we doing to fix the patient? Also, are there any plans for discharge? Needs for, maybe PT recommended they need a walker, or they need home health care when they go home, maybe wound care, something like that. That's good to mention if you're night shift. It's good to mention it to the day shift so they can say, oh, the social worker's coming in about an hour or two. I'm gonna mention that during rounds. And then updates. Isn't it the best thing ever when you are giving report to the same nurse you got report from? Can we just be thankful for that? It's like finding $1 in your pocket and you didn't know it was there. It's just so great. So when you are giving updates to the nurse already knows the background story. They just took care of them 13, 14 hours ago. When you're giving report back to the same nurse, update them with any new orders, any new test results, new IV sites, any changes in the patient's status, or any new plans from the MD. That's it. That's all you gotta pass along. So that is my explanation of how to give effective report nurse to nurse. But there you go, there it is. I hope this helps you have more effective report. Don't forget to check out my other nursing videos and check out my nursing blog. Down below in the description, I'll have links to the blog and all sorts of resources because I wanna help you be a better nurse. Have a good shift.